Hi, welcome back to season 4 of the Tummy Team Journey. I am Kelly Dean, physical therapist and founder of the Tummy Team, and I'm your host. This is the podcast where we talk about how investing in your functional core and pelvic floor strength can actually change your life. So let's get started. Hi, everybody. This is Kelly Dean. Welcome back to the Tummy Team Journey podcast. I'm super excited to have one of our clients on today. This is Diane Bloom, and she is one of our online clients that saw me a little bit in person or in one-on-one with e-sessions, as well as did some of our online work. And I'm excited to have you. Welcome, Diane.
Well, I'm tickled to be here, Kelly. I owe you quite a debt. You rescued me.
Oh, that's so fun to hear. Well, Diane has a really unique story, something a little different than maybe the average client that I see, but she also has a really cool background um, in nursing and in the birth world that I think kind of also gives some interesting insight to the work that we do. So I'm excited to have you share your journey and just kind of your insights into functional core and pelvic floor stuff that you've learned along the way, working with us and just even with your background. So I think it's going to be a really interesting conversation.
Well, thank you.
All right. So why don't we just get started and have you tell us a little bit about yourself? Whatever you want to share, just kind of a little bit about yourself and maybe why or how you heard about the Tummy Team.
Okay, well, first of all, as you see, I live at the coast, so I'm not near a lot of resources. We're pretty isolated out here. And I'm 79 years old, 78, going on 79. And 2 years ago, I was diagnosed with uterine cancer. And I found out that I needed to have surgery like as soon as possible. And I have a daughter who's a chiropractor and works with mothers and babies, and she was familiar with your work. And she said, Mom, she said, you have to just have a session with her before you have your surgery so you are able to move and get around and recover yourself adequately. So then I called Kelly and I said, I have a background as an OB nurse. I worked for 40 years as a perinatal clinical specialist, and I'm a certified nurse midwife. So I have a good understanding of the female anatomy and have worked, extensively with mothers and babies. But to have this happen to myself was quite earth shaking. And it was a incidental finding. I was totally asymptomatic. And my gynecologist decided to do a pap test, even though I was way past the time that it was required. And I said, go ahead. We have nothing to lose. And sure enough, boy, it came back positive. I had a biopsy that came back positive, and then I needed to have a transvaginal hysterectomy, and they took out the ovaries and the tubes. But needless to say, it just shook me up like an unbelievable amount. And I knew about the anatomy. I'm a little bit more on the heavy set side. I'm, about 160 pounds and about 5'2". And I knew that there's no way at my age that I could go through surgery without some type of help in terms of being in shape before and recovering myself afterwards. I'm fairly active. I like to swim. I like to hike on the beach and walk, and I do Pilates and some strength training. So I just wanted to be able to do all this stuff. And I felt like, my life was over with having abdominal surgery. So I called Kelly and said, can you help me? And she did an assessment on the phone, which was really, I'm an older person, so I'm not used to all of this technology stuff. And I thought, how can she ever assess how my physique is in terms of being ready for the surgery and my muscle tone when, she's so far away? And it really didn't end up being a problem at all. She's quite skilled at doing it online from what she can see and how I moved and what I could do. She told me what to do and if I could do it or couldn't do it, and different movements, and really helped her to figure out what I needed. And then I did a rush job on her abdominal surgery course. I took the course, but it was faster than she allowed me to go through it faster. Number one, I had some information, but number two, I had surgery facing me, so I didn't have the luxury of like 6 weeks to do it. So she walked me through with doing it. I think we had either one or two, private sessions because I just had a lot to do in a short amount of time. And, I just felt like afterwards it just really saved my life in terms of moving and turning and coughing and getting my muscle strength back. I don't feel like I had a really severe diastasis, but I just don't have good core strength, which
Yeah.
is really what I needed. And so I recovered from all of that and, tried to, got my squatty potty and, tried to remember all of the things.
Yeah.
And this past fall, my back, I have severe arthritis. My back has really started acting up and really bothering me. I'm really walking quite bent over. And I thought, you know what, I've got to get some strength back because I found that when I was standing really erect, my head was tall and I was in a good, your bowl position. The pain was a little bit better, but I was so fatigued with trying to maintain that position. And at nighttime, I would just totally collapse that I did the core foundations course and am now doing the next core course with, I
Okay.
can't remember the
Functional
name,
core, maybe?
functional core, and probably up to week 7 now with that. And it's really helped tremendously, but it's still, I was about ready to call you and say, I think, maybe in another week or two, I probably need to do one-on-one to see what I can do because I'm still collapsing like at the end of the day, but
Yeah.
it's really been so beneficial in terms of, things like urinary incontinence. You run into that quite extensively, like in terms of your muscle tone,
Mhm.
helping you control that. I don't necessarily have a problem with it, but if I cough or laugh a lot, I might leak some.
Mhm.
So it was wonderful to, get some exercises that could help with that rather than just the regular Kegels that everyone does.
Yeah.
So that's kind
So
of what my story is like.
yeah, so that's so fun to hear, like, just kind of where you started. So, like, when you first reached out, I knew your daughter pretty well, and I remember that first conversation you had a lot of questions. We kind of had to navigate how to get us online. Like I think we maybe did a phone call first, and then I said, let's do an e-session so that I can ask you some more questions and look at you and show you some things. I remember that because you had kind of that you needed to get to the surgery quickly, we kind of did what I would call a crash course. I have a crash course for pregnancy for people that find out like kind of like right before delivery. And I'm always like, even if I had one session with somebody before delivery, it could be super helpful. I feel the same thing about going into a surgery. If I feel like if there, I can even just have one session with somebody where I can get you to connect to your core, do some breathing, work on some alignment, and set you up for what you're going to need to do post surgery or post birth, in whichever case is I'm working with. Helps so much because right after your procedure, you're not really in a place to learn information or get online or anything like that. But those first few days, first few weeks could be so much better if you had just a little bit of information ahead of time, like just knowing how to position yourself, how to get in and out of bed, how to protect the incision, how to start doing some breathing to connect to those muscles. So it's so helpful. That's why we do that pre-course. Is because there is some stuff you can do to prepare those muscles before a surgery, but it's so much giving you that initial knowledge and resources for right after the procedure so that you can really protect those muscles and help them to recover quicker. I remember you reaching out after your procedure as well, kind of telling me what was working and what was still difficult. And even with that, I think I emailed you back a couple of focus on these two things. Sometimes when you're in it, it's hard to know, and I like to give people those resources to really feel empowered going into that situation because the surgeons are great, but their job is surgery, not surgical recovery, you know, not preparation for the muscles beforehand. Um, but knowing that, and knowing that you felt a little weak going into the procedure and you're like, well, I'm only going to get weaker afterwards, right? So having that is really helpful. Were you you were a little worried about doing it online, right? Because you're not very technically savvy. And because of what you said, like it's difficult for you to imagine because you're so used to working right with people, how it could be helpful online. Could you talk a little bit about um, kind of how this has helped you, even though it's been over a computer?
Well, it's just that well, number one of the things I really found beneficial, Kelly, is that in the courses that I've taken, and this is like the third one now, after doing the abdominal one and core preparations, and now being mostly through core foundations. And I've also listened to some of I'm also a swimmer, nothing like you are in terms of an athletic person, but I swim, 3 times a week,
Yeah,
laps. And it was just, see, where was I going with that?
that
Uh,
you watched several things
oh,
online.
yeah. And it
Yeah,
was just, extremely helpful because things were repetitive.
yeah,
Like in each course, you might have repeated the alignment section.
yeah,
And the thing I've listened to like a dozen times, dozens of times, is the one on compensations, because you
yeah,
can figure out how to do something, but then your muscles get fatigued and you start compensating. It was nice to be able to go back and look at
yeah,
the the look at the compensations and things that I was doing because I could feel it.
yeah,
But and then also with in core foundations, you always do your introduction, and then you have your content. But one of the really nice things is you can just go back and like focus on a couple of the exercises. You don't have to listen to the whole 10 or 15-minute segment.
right.
You can just go back and focus on that. So that really is very beneficial in terms of learning, because normally you just have one session and it's not recorded. You can't go back to it. If you meet with someone,
Yeah,
they'll give you a handout. And your handout, the things that you had online, I thought were exceptionally good, because a couple of times I said, oh, I'll never remember this. And then I went back and I watched it again online, but then I pulled out the handout that I had printed up, because I still do everything paper and computer, which is not probably the best way, but it's how I am.
that's
And
why we have the handouts.
yeah, and the handouts are really, very good. I have them printed out, and sometimes when I'm exercising, I'll just throw them on the floor and, read them.
Yeah.
So it was a good experience doing it online. I was pleasantly surprised.
Well, and even when we do our one-on-one sessions, I record them with you and I send you the recording so that I personally have been so many times been at a doctor's office or with a therapist and I'm like, I remember the piece that stood out the most at that time.
Mhm.
But then I'm like, oh, I wish I remembered that other thing they said. And we can only process so much at a time. And when
Yeah,
you're what your focus was when you were going into your surgery and recovering from your surgery was very specific. Now, what your focus is, because you're having this arthritic back stuff going on, your focus has shifted. So even though it is similar or the similar content, or you're even watching a video, the same video, the way you are processing the information is different because you're looking at it from a different lens. And then also, as you go through, usually people start out compensating with certain muscles, and then as they get stronger, they don't compensate with those muscles anymore. But then we start working on standing, and there was like, oh, now I'm compensating with this muscle. As soon as we challenge you or we build something else into it, your body finds another way to detour when there's weakness. And it's kind of cool for you to be able to be an kind of an observer of your own body. A lot of times in those videos, I know that you're trying to figure it out for yourself. So I am trying to explain it in a way that if you feel this, this is what's going on. If you move around and you feel this, this is what's going on, so that you can start to go, oh, I know what's going on. And then once you're not even in front of the video, you know what that felt like, right? You've experienced it. So I love the online portion because it really does set you up to have the ownership of the process.
The other thing I really appreciated, Kelly, was that a lot of times you've said this is not like an exercise program. You
Yeah.
know, it's not an exercise program. This is something that you really want to incorporate into all of your everyday activities. And
Yeah.
your whole focus, I thought, for the whole program, for all your programs, has been integration, not just performance. And I thought this just came glaring through when I looked at your section on, like, I get a fair amount of back pain. I love to cook. I mean, I can stay in the kitchen for 4 hours cooking, but my back just starts killing me. Or if I'm doing a lot of dishes or something, you know, my back, my low back just really bothers me and I'll have to sit down. It's gotten a little better since I've been following what the directions that you gave, but you did that segment in your kitchen about
All the
working kitchen, all the things in the section on cleaning. The cleaning I got pretty down pat. That was not a biggie, but the thing in the kitchen, because I
Yeah.
do so much of it, but to watch you, like how to stand at the sink and how to leverage yourself and how to cut. You know,
Mhm.
I'll find I'm thinking, oh, my back starts hurting. Then I remember I saw that on the video. So
Yeah.
try correcting it. And that's been exceptionally helpful. And that's something you don't get, like if you're in person in someone's office, you really can't like pick that up.
Yeah. And it's one of the reason that I film all of my videos in my home and around the home. And even when I do my e-sessions, I do them, I have my office space, and then off of my office space is like my bed right there, because I know that you guys are doing it at home, right? And I want to show you in the environments that you are actually living in, because I could do something really great on the floor, but if you are not getting up and down off the floor to do the exercises, that makes no sense. Or I could show you something on a treatment table in a therapy space, or with certain equipment that you have at a gym, but like that's not what people's real life is. And one of the things we talk about is that this is real life rehab, and it's about function over fitness. Although we do have fitness programs, it's really about what you're doing all day long, because that's how you're going to build the most strength. So I try to give you as many of those resources as possible. I've gotten very creative filming things like in my car and in my bathroom and in my kitchen. And yeah, it's we built a new house during COVID, and all of the colors in my house are very much on brand with Tummy Team colors. I didn't do that on purpose. I was just like, these are the colors that make me feel happy. And my assistant was watching like me film all these things. She goes, "Your house is like a studio for the Tummy Team because it's all the same colors." But it's just just that's what makes me happy. So but I'm glad that you could see that. And I think it is, once somebody telling you how to stand in the kitchen and unload the dishwasher, for instance, or chop your vegetables, or do a stretch at in the kitchen, telling you versus showing you is very different. Like you being able to see like how I'm chopping for a little bit and then I bend over and I do a little hamstring stretch and then I come back up.
Mhm.
Is that helps you kind of go, oh, this is how you practically do these things in real life. Yeah. And I cook a lot too. So fellow swimmers, fellow foodies, that's me and you. Um, when you can you talk a little bit about um the surgery, not necessarily the surgery, but like how the videos ahead of time, did those help you feel a little bit, because it was an urgent situation, it was a little bit stressful. Did it help with that stress some, having something that you felt like you could be doing?
Definitely. I felt like well, you know, I just had a million questions. If you're a healthcare provider and it's you, the questions just don't stop. And I know I asked you a million different things, and I had a lot of concerns about removing internal organs and the type of supports that someone would have, and how to maintain your pelvic integrity when you're losing half of your substance that's in your pelvis. So that was, a big concern for me. And I think also, I don't feel like I've always thought the woman's abdomen, being a midwife, I always thought that was just beautiful. I've never had any bad feelings or anything. I just think the female body is quite magnificent, and the abdomen and the way it expands, and even the stretch marks and the breasts, and it's just all beautiful because that's just what womanhood is in my perception of things. But probably everything that I learned from you, it made me like not. I never had. Well, I had 2 cesarean sections, which I certainly hadn't anticipated.
Right.
And that's another whole story. I don't think I was traumatized. I don't think, I probably was, but it
Right.
was so, it was 40 years ago. So, it's kind of in the past.
Mhm.
And I've, really done a lot since then. But, you're just bringing it up that is still a trauma to your body. And then this
Right.
surgery was a trauma again. I did remember, some of that. So this surgery was much different than having a baby.
Yeah.
And the way I felt internally was much different. But I think going to your classes made me much, I was not afraid to touch my abdomen after I had the surgery.
Yeah.
And I think that if I would have not had your course, I would have been much more reluctant to feel my abdomen or to massage or to help, like you had said about trying to move the air in your intestines by going around. I think it was a clockwise circle. The things that you had said about that to kind of get the air moving so that you could pass some gas after surgery, which is so important. So it was things like that that was really, extremely helpful. And
Yeah.
also, I think knowing that there was a resource to call if you wanted help. That was
Yeah.
the other thing, that there was someone that if you needed help. And I think I might have called you and just said, I'm just so concerned, like what's there to support everything afterwards? And you were just so reassuring that,
Yeah.
you can get your muscle strength back and, repair with the
Yeah.
appropriate, exercises and everything. It's, going on 2 years, and I probably didn't follow up with core strength as much as I should have. I mean, my back is what's really pushed me now because, I'd gotten along for, 70 some years with half decent posture, but, my back hurting me now has just really made me, and I wish I would have done it, 20 years ago instead of waiting until now.
Well, that's just kind of how we are, right? Like we're a negative feedback system. When things are working well, we just keep move on driving. But when, we get that squeaky wheel, we have to pull off and check the engine, right?
Yeah,
And that's kind of
good
how we
analogy.
yeah, that's how we are. And it's okay. I do want people to be proactive. And one of the things that I think is so great about having clients share from all different seasons of their life is for us, for all of the listeners, like maybe you're younger and you're like, okay, being proactive now is going to like, yeah, things are okay now, but what if I could really strengthen things up now so that as things naturally decline as we age, that decline is not so impactful on my body. And then if I have older clients feeling like, okay, it's not too late, I am 70 and there are still things I could be doing that would make me feel better. So I like having that perspective of all things. You talked about us being swimmers, and I swim masters, so I swim with swimmers of all ages. And I was at this masters meet, this national meet a few years ago, talking to somebody that was still swimming and still competing, that was in her um like 60s, almost turning 70, I think. And I was, at the time, I hadn't quite turned 50 yet. And I was talking to her about kind of like, how, what her advice was for me to keep in the water till that point. And she said, the best thing you can do is use this time to get as strong and as fast as you can, and then just try to hold on to it for as long as possible, and everybody else will just start getting slower, but you'll stay up there. Because but I was like, it was so like, okay, instead of like thinking, oh, I'm gonna she goes, "You're not gonna get better as you get older, but if you can get as strong as you can now and just hold on for as long as you can." And I've used that kind of analogy in so many different areas of my life because there is a natural decline that happens, but if we can slow it, or if we can start from a stronger place, then that decline is not as traumatic on our body, right? So trying to get as much strength, and I've really thought about that going into menopause, being as strong as possible so that when there is some natural loss of muscle mass, I at least started from a really good spot, right? And it's about being proactive. Um so I think that's good information for people, just a perspective to think about, and that it's not too late. There are things you're doing right now that are improving, and I would love to do another session with you and kind of tweak things for you. Um, let's take a moment and talk about one. We had a really fascinating conversation, kind of, I think, early on, where you were first getting some of this initial information and how I talk about the transverse abdominis and the core and the floor of your core and the coordination of it all. And you were talking about how you could connect these dots with your history in the birth world. And I would love to just have you share any of those kind of insights or revelations that you had along the way, if you have those in your head.
I just think that as a midwife, your your whole approach in terms of strengthening the internal ligature, supporting the uterus and the baby, and we have these big broad ligaments that come back and support our abdomen. And sometimes people wear abdominal splints or belly bands or whatever they're using now. And I think that there's a lot more that could be done, both before pregnancy, probably, and early pregnancy, to keep that muscle tone. Maybe not to develop it, but to keep the muscle tone that you have, or
Maintain
to
it.
increase the strength that you have so that you can more effectively move through your pregnancy. Because people have a lot of back pain and shoulder pain carrying these huge tummies in front of them. And I think many of the suggestions that you've had were just absolutely superb in terms of strengthening the musculature that's supporting the uterus. And I think it would certainly cut down on a lot of the symptoms,
Yeah.
the symptoms that women have when they're pregnant, if they could make themselves available to a course like this. And I think your family, I thought it was really nice how you did your family plan. You have a bunch of free information online, but then you did your family plan, which is really, I think, affordable for a fair number of people.
Yeah.
And, and it was, if you needed more help, you could pursue this, but there was adequate help,
Yeah.
is
Yeah.
how I would probably say it. But I certainly think that prenatally it would be immensely helpful, but especially postpartum. And you obviously know about the trials and tribulations of being a new mom,
Yeah.
from both personal experience and from all the clients, and that
Mhm.
there isn't time. You're handling two or three kids and you're still, you feel like you're falling apart physically and maybe emotionally,
Yeah.
and how to get yourself back together again. It's just so important.
Yeah. Yeah, it is, because you are, the women and the moms are the foundation of the whole home. You bring your energy, sets the tone for the whole home. So you being strong and stable and pulled together emotionally and physically is essential for everything. And I want people to realize that, it's little things that they can do, right? It's completely doable. Um, I love that you also, we had a conversation and you mentioned it briefly about the squatty potty. And like, I actually talk a lot about potty posture while they're pregnant, talking about the coordination of the core and the pelvic floor, um, while they're pregnant, and to have more effective bowel movements, because that can be a problem while you're pregnant. But it also is setting the tone for the coordination for birth. The core supporting the uterus, and the pelvic floor being able to release is the same as the core supporting the GI tract and the pelvic floor opening for a bowel movement, right? It's the same coordination. And a lot of people are pretty uncoordinated about that going into birth. They're pooping
Mhm.
incorrectly or ineffectively, and then they're trying to use those same strategies at birth. But it was also something really valuable for you post surgery, like the having bowel movements post surgery after having a vaginal surgery can be really scary. So can you talk a little bit about your experience with the squatty potty?
Well, I just, I started using it when I did the pre-abdominal surgery prep course that you had. And I had previously tried something like that, but never pursued it. I mean, I knew about it. I knew
Yeah,
that was the best position. I know that many people would give birth in that position, but it just never seemed to work and it didn't seem comfortable. But after, I listened to you, I went ahead and I bought one for each bathroom and it just made myself do it. And now I'm just so used to it. And you're absolutely right. If you're just patient, it'll come without straining.
yeah,
And it's extremely helpful. And, the toilet seats used to be very low and then people had trouble getting up. So now they've made them so high that we're
yeah,
really not in a natural position. And I think things just come out much better with
yeah,
that. And again, those being able to go back and rewatch the video that
yeah,
you made and, to relook at your handouts was extremely helpful.
yeah, yeah. Um, so when you what is your current kind of routine or current focus? And it doesn't have to be perfect, nobody's perfect, but what are some of the things right now that you kind of since you've kind of worked with us that you've kind of changed pretty, squatty potty is one of the things you've changed for good, right? Are there other postural things that you've changed? Are there other stretches you do on a regular basis? Are there breathing exercises you do? Like kind of give us a little bit of a look of what your current like routine or your focus is right now. I know the back
Well,
pain definitely.
one of the things I was amazed to find out is that the we have muscles that we aren't even aware that they're there or how to work them. And when my daughter first was working as a chiropractor, I had been doing exercises, but not appropriately. And she said, "Oh, mom," she said, "your abdominal, you don't have any strength in front. You're always doing sit-ups, but your back muscle." I didn't even know where my glutes were. I mean, I couldn't make them move or contract or anything. So I started working, and it really got so that I can relax them and tighten them. And I had to learn how to do that with my pelvic muscles too. And so, I was able to learn how muscles feel. And my transverse abdominal muscles, I had no sensation of them tightening. And I have never had like really bad back shoulder pain, but my low back pain is, pretty severe. And now I notice that all during the day, if I start crunching forward instead of sitting up erect, my back really starts hurting. So throughout the day, if my back's hurting, I remember, zip it up
Mhm.
and also the exhaling, like tighten it up and blow out. I
Yeah.
do that a fair amount throughout the day. And
Yeah.
I try to do some of your exercises of relaxing the perineum and tightening up the internal sphincter muscles after you're finished voiding.
Yes.
Try to
Yeah,
do
doing a
that
couple
one.
squeeze and releases right after you use the bathroom just to stay connected to
Yeah,
those muscles.
yeah. And then, I've noticed now in the kitchen too, if my back starts aching,
Mhm.
and I've been wearing the abdominal splint and that helps, but I'm very short waisted. So I just ordered um, the
The
two
2
band one and I have one, but it's in the small size and it's too tight. So I'm
Mhm.
waiting for my other one to work, but it seems to just give me enough support that my back doesn't hurt as badly, or maybe it's just that it reminds me to stay upright,
Yeah,
and not,
we talk about the splint as it should remind you which muscle work it should be working, and it reinforces it when it fatigues. So it's not like doing all the work for you, but it does kind of like when you're fatiguing out, it kind of gives you that little extra support. But it also tells you this is the muscle because sometimes those compensation muscles, try to do like you squeeze your butt or you lift your shoulders and then, you're missing the part that's actually helping you. And then we have a whole nother set of pain stuff that's going on.
And I always liked it when you said, if you feel like your muscles are tight or you're compensating with your shoulders or your butt muscles,
Mhm.
just rock back and forth on both legs.
Yeah.
That was very helpful. Or switching your weight from side to side
Yeah.
because when you were doing that stretch, you said to lean forward to make sure you don't hunch your shoulders forward. Your hints like that, obviously show that you've been doing this for a long time. You really know what you're doing.
I know the most common things that people are gonna do incorrectly, and I also know, like, I want people to not just be able to do it when I have my hands on them. I want them to know what they're feeling when they're not. So, like, giving you those cues, like, sitting back so you feel the weight in your heels or shifting your weight or, that blow as you go, that exhale and engage, that zipping up. Like, some of those visual, cues, those words that I say a lot, those word pictures really help people to take it home with them. Like, I want you to own this, right? So I love that. Um, I always like to kind of wrap things up when we have a good conversation with a couple of questions. One question is like, and you've already talked a little bit about this, but something that you wish you had known sooner. That you like anybody that if you could have talked to yourself earlier before you had the diagnosis, kind of what you wish you had known sooner, and then anything else you might want to share to people that are listening to encourage them.
Like, I think that before pregnancy, having a strong core would be outstanding. I mean, of everything that you could do for yourself, having a strong core before you even get pregnant would be wonderful. And then certainly working on it afterwards if you don't happen to get
Yeah,
help, or at the last minute, if you even one or two classes or sessions or watch one or two videos that you have before you deliver, it would have to help you.
yeah,
And especially afterwards, because you really are in no state of mind to learn anything new after you've had a baby. You have so
yeah.
many new things to learn that you have to. Your body's like the last thing that you would probably focus on. So, doing a little of that prenatally would be wonderful. But I think also as an older woman, I just wish I would have started this when I was 40 or 50.
Yeah.
The whole posture thing, the whole strong core, because it really would, um, uh, help me not to walk bent over now and not, keep my shoulders back and to not look like I'm falling apart when I'm walking.
Yeah. Yeah, I mean, there's every season, like, and that's the thing is people sometimes will like, "Oh, I'll deal with that after I have kids." Well, you're gonna about to do this really demanding physical thing by getting pregnant and giving birth. And after you have kids, you're going to have to learn how to take care of kids. Like that's what is going to consume all your time. So I do one of the things that in our prenatal classes that we do a lot is giving people things for that initial postpartum stage, newborn parenting postures and what they can do while they're nursing and what they can do while they're changing the baby's diaper and what they can do while they're pushing the stroller. We build the strategies that you need postpartum into your postpartum world, but like you said, you're not going to want to watch and learn that stuff at that time. So if you can learn it beforehand and then just know, oh, I'm just going to check that video. I remember I watched something about this. You have that resource. Um,
Mhm.
but I also love what you said about that 40, 50-year old, because sometimes I see people that are like, I should have dealt with this right after I had kids, and now my youngest is 8 or 9. Is it too late? Never too late. Never too late. You know, everything you do is a deposit into this bank. And those deposits add up and they build interest and they build interest. And then when you need to take, a big withdrawal, you have, a substantial, you know, nest egg to pull from, right? And that's what
Well,
I'm
the other thing, Kelly, is if you don't want to use medicine, if you don't want to take, if you're an older person and you're concerned about taking too many drugs or pain relievers, if you do have arthritis in that, this is one of the few alternatives that is offering some relief. It's not without effort, but it's
yeah,
offering some relief
yeah,
without medication.
yeah. Yep, for sure. For sure. Yeah, and it just all works together, right? So that's awesome. All right. Well, this has been great. Do you have anything else you want to share before we wrap up?
No, I just appreciated this opportunity, and just I wish I would have done this a long time ago. I wish I would have done your core foundations a long time ago, but I didn't. But I'm 78 and I'm doing it now. I think your thing about just maintain where you are. If I
Yeah.
can stay where I am and don't get any worse, I'll be fine.
Yeah.
So
Well,
I appreciate it.
anything that you can make better. It might not be 100% better, but 50% better is still better. I want to be better. I want to feel better. And every little thing does add up. And I'm glad that you are kind of continuing to work through it, even with the technical challenges. You're doing it. And yeah, and there's always things I'm learning too. That's the cool thing about that family plan is I am filming new things all the time that I'm adding to those small courses for people to learn more stuff. So there'll be more things
I,
for you to learn too.
I did want to tell you, I also have this feeling that, I'm working on this now because my back is so bad. But I've been saying to myself, well, there's some help for you. You can call Kelly when you're ready, and she'll probably take a look at you and tell you what you can do to make your back even better than you're doing now. And just knowing that that resource is there is really beneficial, and I thank you for that.
Yeah. Well, I
We'll
love
be
to.
calling you.
Good. I love that. I love that. All right. Thank you guys. Thanks everybody for listening today. And I hope that Diane's story, was inspiring to you that you're never too old to get help. And if you do have a situation where you have a unexpected procedure coming up, that there is something that you can do, or if you know somebody that has that, we want to empower you and give you the resources and the support that you need. So check out what we do at the Tummy Team, and thanks so much. We'll see you guys next time. Thanks, Diane. Once again, thank you for joining us at the Tummy Team journey. We would love to help you restore your core and be strong for the life you were meant to live. You can get more practical strategies at thetummyteam.com, and we'll see you next time.